An intense stomach bug that can linger for weeks is spreading across the country. It's called Cyclosporiasis. And here in Arizona, there's been at least 10 cases reported. Dr. Natasha Bouillon, National Medical Director of One Medical, is here with what we need to know. All right, this sounds so scary, especially, we're talking explosive diarrhea being one of the effects.
Yeah. I mean, it's certainly not pleasant. So cyclosporiasis, it's essentially an intestinal infection. It's caused by a parasite. Now, we see this typically every summer, and the reason why is because that's when people are consuming more fruits and vegetables that are imported. But this year we have far more cases than in the past, and likely the cases are undercounted because not everybody who's infected gets tested. Now, the symptoms are very hallmark. People will have forceful, watery diarrhea, known as explosive diarrhea. People have abdominal pain, loss of appetite, sometimes a low-grade fever. But of course, what we really worry about is when people get dehydrated, because that's what can lead to hospitalizations.
Yeah, if this is seasonal, we're talking May through August, why is this year, we're seeing so many more cases?
That's what public health officials are trying to figure out, because we do see this every year. We're seeing a lot more now. They don't know exactly why we are seeing a lot of outbreaks, but typically we see it from fresh produce. So these parasites will live on raspberries, blackberries, even fresh basil, green onions, snow peas. And so the one good news is that it's not transmitted person to person, which is what we often see with other foodborne illnesses, but it is unique because a lot of other foodborne illnesses, they're from meat, and this is from produce.
Okay, so what can we do to stay safe?
Yeah, it's really just a couple of simple food safety measures we can take to stay safe. Number one, always wash your hands before handling food. Something important to note here is that alcohol-based hand sanitizer is not effective against this parasite. So you really need to wash your hands with warm soap and water. And then the other big thing, wash your produce. And so think of things like even the raspberries and blackberries, those parasites get in the crevices. So you really got to scrub that produce. Even the bagged salads, a lot of people don't wash that. If it's triple washed, you don't need to wash it. But otherwise, you really should rinse it.
See, and I think a lot of people don't think, oh, bagged, it's already been washed, but you really got to read the label. And especially if you're saying, it should say triple wash, I don't think there's a lot of bagged salads out there that are triple washed.
And so you really got to wash the produce. And then the other tip I give people is that if you have diarrhea that's longer than a day or two, you should see a primary care provider. And the reason why is this infection can sometimes last weeks, even up to a month. The other pattern we see is people will sometimes get better, but the parasite is still in the intestine, and then they get symptoms again. And there is a medicine people can take to eradicate this, but you've got to get tested to figure out it's what you have.
Okay, so if there's medicine, then see your doctor. So it has to be prescribed, obviously.
It's a prescription medication, and we've got a test for it. So again, diarrhea for longer than a couple of days, you should check out your PCP.
Okay, so bottom line?
I mean, the bottom line is it's still safe to eat fruits and vegetables, because certainly the amazing health benefits of fruits and vegetables far outweigh the small risk here. The important thing is just be safe and wash your produce.
All right, great advice as always, Dr. Bouillon. Thank you so very much. All right.